Dr. Scott, we are happy to have you as a speaker at our Biohacking Congress in Silicon Valley on November 20th. Thanks for joining us. And let's explain to our followers that it will be an all-day on-site event in Mountain View for a small group and with live stream for our big global community. So for those who cannot join us in Silicon Valley, it is still opportunity to watch the live stream of this event. There will be up to 15 great speakers, biohackers, experts on health optimization and longevity. So hurry up and book your access to live stream with 50% discount by promo code biohacker. You can find the link under this video. Now let me introduce one of our speakers, Dr. Scott Sher, board internal medicine physician certified to practice health optimization medicine and a specialist in hyperbaric oxygen therapy. Dr. Scott,
hello.
Thanks for joining us. Thanks for joining this interview today.
Good morning from California. How are you?
I'm good. And you?
Doing well. Just getting myself ready for the day.
Are you excited by this future event that will be on site? What do you think?
Well, I think it's novel these days to have an on-site location and a meetup, but I think it also is great, and I think that you have both the option.
Do you know it will be a small event just for 50 attendees, even less than 50. We are going to invite personally almost all of attendees, and there will be biohackers from Silicon Valley, San Francisco, Los Angeles. Some of our speakers are going to join us from Los Angeles. And also there will be founders of healthy companies and investors from biotech and health tech areas. And by the way, Kayla just wrote me just in few minutes before our interview that she will be able to join us as a speaker.
Fun.
Yeah, good. Kayla Osterhoff, I mean, BioCurious Kayla. So it's going to be...
Look at that, cool.
Dr. Scott, as I know, you devote your work to helping people optimize their health, and you create personalized treatments for patients, correct?
Sure, that's true, all true.
Yeah, and I know that at our Biohacking Congress, you will speak about your clinical practice that combines hyperbaric oxygen therapy and health optimization medicine. And
that's
I guess... Yeah, I guess we will learn a lot of interesting cases because I'm sure that during your long practice, as I know, you practice more than around 10 years or not. I'm sure that we will learn a lot of interesting cases, and our guests actually will be able to ask their questions. I would like to start from hyperbaric oxygen therapy. Could you please explain the main principles and how it influences on our body, gene? How does it work?
Sure, yeah, hyperbaric therapy has been around a long time, but it's been more in the optimal health biohacker performance world for the last 20 years or so. And it's a combination of increased atmospheric pressure and increased inspired oxygen. So the pressure at sea level we call sea level pressure, which is sort of by definition 0 or 1 ATA is the sort of the other definition, the pressure definition. And if you increase the amount of pressure that you're under, if you go under a certain amount of seawater, for example, the water above you is extremely heavy. And that water, even if you're below the water, if you're diving, if you're scuba diving, if you're snorkeling, if you're just swimming, all that water is above you is exerting a pressure. You don't feel it though because you're weightless underneath the water, but that water is very heavy. It's that heaviness that we can simulate in the pressure, simulate in the chamber, excuse me. And so that we're increasing atmospheric pressure, number one. And number two, we're increasing the amount of inspired oxygen. So the amount of oxygen that we're breathing at sea level is about 21% in the air that we're breathing at sea level. And in a hyperbaric chamber, we can increase that to up to about 100% if we want to, depending on the indication. And it's a combination of the increased inspired oxygen and increased atmospheric pressure that drives more oxygen in circulation. Oxygen typically gets carried by red blood cells in our body, the cells in our body that have a molecule called hemoglobin on it. Hemoglobin binds oxygen when you take a breath, takes that oxygen to your tissues, delivers the oxygen to your tissues, and allows your tissues to make energy because oxygen goes over to the mitochondria in the cells and helps you make energy by being the final electron acceptor on the electron transport chain. So because we're getting a lot more oxygen in circulation here, the red blood cells only have a finite amount of oxygen that they can carry. The extra oxygen that we're diffusing in the system is actually getting diffused into the plasma itself, the liquid of your blood. Now, typically at sea level pressures, so when you have regular sea level pressure, when you don't have increased atmospheric pressure, the plasma or the liquid of the blood has very little oxygen in it. And then when you put pressure under in somebody's pressurized environment, if you increase the pressure in an environment and you have more oxygen that you're breathing, then you have more oxygen that's going into circulation, not only in the red blood cells, which have a finite amount they can carry, but also the plasma, which has a dramatically almost an infinite amount of oxygen that it can carry in essence. And that's liquid oxygen. So typically in the chambers, we're getting up to as much as 12 or 1300% more oxygen in circulation. And then when the oxygen gets in, it has all these really cool effects, depending on if it's an acute infusion of oxygen that we care about, or if it's more of a long-term protocol of oxygen therapy that we're discussing. Really, it's related to the oxygen infusion or epigenetic changes, how the body changes after being infused with so much oxygen, how the DNA changes expression of various genes that are responsible for growth and healing. I like to summarize it very simply. It's hyperbaric therapy reverses low oxygen states or hypoxia. It does that in the short term by infusing the body with a lot of oxygen. In the long term, it actually gives a stimulus to create new blood vessels and then create sustainable oxygen flow over the long term, oxygen, nutrients, etc. The second thing it does is decreases inflammation and swelling. It does that immediately and also does that over the long term by actually having an effect on inflammatory cytokines and things like TNF alpha, IL-1, IL-6, and things like that. The third thing it does is release a bunch of stem cells, exponential numbers of stem cells from the bone marrow and the brain. And these are the cells that can go to any particular area in the body and cause the stimulus to heal, whether it be bone, nerve, connective tissue, heart, you name it, it can make it because these stem cells are these nascent cells in our body. And the fourth thing is it can do is oxygen can kill bugs, especially bugs that do not like high oxygen environments. So it just depends on the protocol, depends on the indication, but we have lots of them, both acute indications, things that you want to immediately get into the chamber for, and things that are more long-term chronic issues or chronic goals like optimization and things like that. Those take a longer time in the chamber to really see the benefits typically because you're looking for that epigenetic shift.
So thank you very much for explanation. You mentioned that it is some similar with scuba diving. Do you understand right or not?
Yes.
So
yeah, that's where
I just like scuba diving very much, and when I under the water with all this equipment, I feel me very relaxed. Of course, very beautiful atmosphere underwater, and maybe it influence. But could you explain? So it's some kind of getting more oxygen. That's why.
I mean, partly it could be that. Partly it could also be the nitrogen that you're getting in the air that you're breathing. Because typically when you scuba dive, you're not breathing 100% oxygen. You're breathing sea level oxygen compressed in a tank that's behind you. And when you're doing that, you're getting increased oxygen in circulation, but you're also getting increased nitrogen. And so at a certain level, you've heard of nitrogen narcosis. If you're a scuba diver, you're getting too much nitrogen in the system. That can also cause you to get a little giddy. So you have to be a little bit careful of that, as you probably know if you're scuba diving. But yeah, you're getting more oxygen in circulation. You're also getting to be underwater and seeing the beautiful sights, etc. So the combination is good, and it's nice and relaxing. I mean, we have people meditating, and it can have, a similar effect.
So we can do this hyperbaric oxygen therapy just in nature. Yeah.
Also. Well, you can. It's just not that easy to go scuba diving and sit underneath the water, 30 feet under the water for 90 minutes and get the same effect. But they've done some studies looking at veterans, for example, with traumatic brain injury, and they took them all diving, and they would go diving, and their symptoms got much better. And they attributed it to going underneath the water and seeing the fish or whatever, but they forgot and they neglected to even mention that they were in a hyperbaric environment for the time that they were down there. So I think that was probably some additional stimulus to help them improve their symptoms, because we know hyperbaric therapy can help in patients that have had traumatic brain injuries.
I understand. And you also mentioned that patients can get some very fast results and some long-term results. So could you please explain what are the fastest results, and how many times we can use this hyperbaric oxygen therapy without prescription if people don't have some disease and prescription doesn't need?
Well, I mean, I think, just to be clear, that it's a medical procedure. So you do need a prescription to go into the chambers.
Okay.
In other parts of the world, hyperbaric therapy is not a prescription. It depends on the type of chamber too that we're talking about. But in the US, all chamber types are prescription based. So you need a prescription to go into the chamber. Yeah. So yeah, you asked me about like what happens in, like, what are some of the acute indications, the things that can immediately benefit from hyperbaric therapy versus the long-term stuff. So on the immediate side of things, as you can maybe remember from 5 minutes ago, I was just mentioning that we're getting all this oxygen in circulation, and that really is allowing your cells to stay vital in a potential time when they might be at risk. If they've done studies in acute traumatic brain injury, acute heart attacks, strokes, spinal cord injuries, acute trauma to limbs, surgical indications, so to help people recover from surgery. Really, it's kind of twofold. It's delivering more oxygen and then revving up the whole body's process of wound healing, and it can do that very quickly and much more efficiently than the body can do it on its own, especially if it's a pretty significant injury. So some of the acute indications are the ones I've described. There's others that are in the hospital setting as well. Then you kind of shift over to that's a good list. And then you shift over to like the things that are going on, the long-term conditions, the chronic conditions, the long-term goals, let's say. When you're on that side of things, you really have to be thinking about a larger picture in general to get people better. And it's not just about getting into the chamber. It's about epigenetic shifts, as we described. And those shifts take time, and they take a cellular foundation, in my experience, that can really support those shifts and maintain them and sustain them over the long term. So, but in general, the hyperbaric therapy is approved in the US for 4 major conditions that can be done outside the hospital: diabetic foot ulcers, radiation injury from cancer treatment, chronic bone infections, flaps and grafts in plastic surgery that aren't potentially going to work or take because of vascular supply issues, and also sudden hearing loss. But then we have about 40 or 50 other indications potentially that hyperbaric therapy can be helpful in. And some of the ones you've described, some things like Lyme disease and dementia, traumatic brain injury, stroke, reflex sympathetic dystrophy, pre-post surgery. So optimizing healing after surgery, you can get back on the field if you're an athlete about 50% faster. These are things that are not covered by insurance in the US, but have significant data to support their use, especially if they're done in combination with a more holistic approach. And that's kind of my perspective, is that if you have dementia, you don't just get into a chamber. You have to be thinking about what the underlying reasons somebody is presenting with cognitive impairment are, and addressing those. And if somebody comes in with Lyme disease, really they need a Lyme literate doctor to really be focused on their treatment and optimizing not only their treatment in like sort of the direct effect of the bugs themselves, the Lyme and co-infections, but also in detoxification and lymphatic flow, et cetera. So there's really a lot of collaboration that I do with other doctors and practitioners. And I bring in a lot of other practices and other aspects to what I do, because I know how important it is. If you want to see significant and real sustainable changes in patients that have had chronic long-term things, it's not going to be just getting into the chamber most of the time. And so that's where I use my foundational practice called health optimization medicine, which is something that was founded by a colleague of mine and a mentor, Dr. Ted Achacoso. And Dr. Ted founded this foundational approach. It's not looking at treating disease, not looking at treating any conditions, but really just looking to balance and optimize at the cellular level, at the metabolomic level, which is the level where all the cellular processes are happening, and that we can measure. We can measure things that are happening internally. We can measure metabolites of things that are happening externally, like toxins in our environment, et cetera. So we have, and I use a 7-pillar approach for health optimization medicine with my clients that are interested in hyperbaric medicine as well, especially for these long-term goals, these chronic conditions, or those who really want to optimize and have that reverse aging kind of mentality, right? So optimizing their health, creating the fountain of youth idea and jumping in it.
Mm-hmm. Yes, thanks for your answer. It is exactly what I was going to ask you, that you have been practicing hyperbaric oxygen therapy for a long time, and then you were approached by Dr. Achacoso, and he offered you to work with him, and he is your mentor now. And as far as I understand, health optimization medicine, it is the main your practice now. Yeah.
I do both. I have hyperbaric clinics all I'm affiliated with, all in the Bay Area. I work as a worldwide hyperbaric consultant, advocate, and educator. So I do talks, I do obviously podcasts and things like that on hyperbaric medicine only. But I've gravitated towards at least presenting the opportunity for those that are in hyperbaric medicine or interested in hyperbaric medicine to look at a foundational approach along with what they're doing inside the chamber. And I do have a separate but very integrated health optimization practice as well in the Bay, where I do take people through this process of analyzing their blood, urine, and stool and multiple data points, and creating plans with them that are health focused that don't include hyperbaric medicine as well. That's for sure.
So can we say that health optimization medicine and health optimization practice, it is a framework, and hyperbaric oxygen therapy is one of the options that they use?
Well, it's my framework for sure. It's my framework when people come in and see me. This is how I consider how I'm going to approach the situation with the particular person I'm talking to. So, but the framework always starts with health optimization medicine in my mind. However, people often find me because of my work in hyperbaric therapy. So we often start talking about hyperbaric therapy, and we talk about the ins and outs of that, and then creating a larger context, and then developing a framework in others and the people that I'm speaking with, and how they can really understand their health in a greater way, rather than just getting into a chamber. So, but they're very much integrated. I like to call it's like my ultimate biohack is getting in a hyperbaric chamber and understanding how that technology works. But the foundational stuff is what you need to be doing every day, no matter what. And of course, there's the fun stuff along the way that you can do to help optimize your brain function with things like nootropics, and help you with various other things that you do that I also integrate into my practice. But in general, the foundation of it is health optimization medicine. And then my ultimate biohack, the best biohack in the world as far as I'm concerned, is hyperbaric therapy. But I'm slightly biased.
Okay, now I know that your ultimate biohack is hyperbaric oxygen therapy. Nice. Could you also please explain just a little bit what our guests will be able to learn from your lecture at Biohacking Congress? Just a little bit, because of course we invite all of our guests to watch our live stream all day. There will be up to 15 great speakers, but what they will be able to learn from your lecture?
Well, I hope they can learn a new framework that is pretty revolutionary in its simplicity on some level. And that is the health optimization medicine framework, and how we as a nonprofit company are also building educational content and material for doctors and practitioners to learn this across the world. And we have people in Australia, we have the Philippines, we have Europe, we have leaders in all these countries now. And so we are really looking to build this movement and change the way health is practiced. And I think at the same time, it's important in my particular sphere to talk about this amazing technology of hyperbaric oxygen therapy and how it can really accelerate and synergize wound healing, optimization, and overall health. And there's various ways that you can do that and really see some significant benefit over the long term. So I think that my lecture likely is going to touch on both of those points. and I'm sure I'll be making silly jokes about having a blue tongue during it as well. So.
Yeah, yes. By the way, you have one more product, blue products, and it's also ultimate biohack. So
Yeah, it's
you
an
have
easy thing
two
to take.
ultimate biohacks.
Yeah, we have a for-profit company called Transcriptions, which makes a number of products. Well, to start off with, we have 2 nootropic products that have something in them called methylene blue, which turn your tongue blue. Yes, and they're used for cognitive enhancement, cognitive upgrades and things. And so I'll probably have one in my mouth, or my tongue will be slightly blue during my lecture as a result. But it's again, I think in life, Julia, it's about creating the context for optimizing your own world, whatever that might be. And so for me, that is a combination of medical practice, the creation of a home where I have lots of crazy things going on with my kids, and always enjoying the fun and the playtime here. And
You are father of 4 kids.
Yes, I have 4. Yeah, yes, but I think from a health perspective, it's obviously my personal health that I care about, but it's really trying to optimize and raise the health of those around me that I work with. And so that's what I'm going to help, hopefully, deliver during the time we have together in Silicon Valley.
So today we don't have blue tongues, but
no.
I have only blue dress.
Yes,
so join us live on November 20th. We will live stream all day from the location. There will be speakers and also healthy companies. We will test some interesting products. I think we will also test blue products.
I'll bring some samples, sure.
Yeah. Thank you very much. So, dear followers, dear friends, join us online on November 20th. You can get your access to live stream with 50% discount by promo code Biohacker, and the link under this video. Thank you, Dr. Scott. Looking forward to meeting you in person at the location. Good. Have a great day with your kids. Thank you very much.